My name is Karan Momin, and I'm currently a registered nurse seeking higher education by earning my bachelor's degree. The following project, which I will be presenting, is an initiative that seeks to improve the healthcare system at large. Specifically, this capstone will identify vulnerabilities within the medical system while providing evidence-based solutions. The purpose of this presentation is to propose an initiative that would formally require the implementation of a standardized report to be used during shift changes. Furthermore, this capstone will detail how structured methods of communication can help to eliminate adverse medical events and the omission of pertinent patient information. The specific clinical issue that my project seeks to resolve relates to the verbal information handoff given during shift changes. Verbal information handoffs which lack a specific structure promote gaps in communication, and consequently may lead to adverse medical events. These preventable adverse medical events most often occur when pertinent information is omitted or miscommunicated during the verbal handoff. This issue is especially prevalent on busy and understaffed units. The foundation of my proposal seeks to eliminate this exact clinical vulnerability. My proposal will replace inconsistent reporting with a standardized safety protocol that conveys all necessary patient information to be relayed during shift changes. This project seeks to initiate the mandatory use of a standardized shift report protocol. Through the use of communication aids such as the S-bar, the information exchange which occurs at the bedside will be synchronized across all units. Rather than relying on what specific information the nurse who is signing off deems important, this initiative provides staff members with an objective framework which details all aspects of the patient's clinical situation, while also providing immediate recommendations. This systematic overhaul of the current shift reporting methods will ensure that all crucial details regarding the patient's treatment are accurately conveyed from one shift to another. This initiative and project proposal is relevant to the overall healthcare system. Nurses have a responsibility to ensure that all relevant information is transferred accurately to the next nurse who is beginning their shift. This transfer of accurate and detailed information directly plays a role in keeping patients safe and reducing preventable clinical errors. By improving the transfer of information during the clinical shift report, the overall baseline of nursing care and quality is elevated. Furthermore, by implementing a standardized shift report across the board, there is no ambiguity about what information the nurse should convey during handoff. Through documentation and peer-reviewed studies, it has been determined that a significant portion of handoff-related errors are the result of omitting important patient information during the shift change. Scholarly research indicates that around 88% of handoff-related errors are due to omission of critical patient information. In multiple healthcare facilities, nursing shift reports are performed verbally and do not have a designated or structured protocol. Without structure, important details about the patient are able to be missed for a variety of reasons. For example, a nurse may leave out patient details which they do not feel are crucial to convey during the handoff. Without the use of an objective template to be followed during the handoff, the information that oncoming nurses receives is highly varied. This variance directly affects the patient and the quality of care that workers are able to provide. Relying solely on verbal communication during shift handoff allows for medication errors to take place. To combat this issue, one scholarly article suggests that using a checklist during the shift reporting process drastically decreases such errors. By utilizing a standardized reporting framework such as a checklist, nurses can objectively convey all pertinent information about the patient during the handoff. This in turn improves patient safety while reducing communication deficits. It is critical that we as nurses seek to eliminate medical errors which occur as a result of ineffective communication during shift changes. Here we must implement and enforce standardized shift handoffs because doing so helps mediate the inconsistencies which come with unstructured reports. These inconsistencies directly affect patient safety in multiple aspects of the healthcare system. Miscommunication at the handoff has the potential to lead to adverse events such as medication errors, some of which may be life-threatening. Apart from directly compromising the patient's safety, these shift change-related errors place strain on the facility itself while disrupting the normal workflow. Scholarly research exemplifies one benefit of a standardized shift report by stating, once implemented, the overall handoff completion time per patient was substantially lower. Through research such as this, the importance of a standardized shift report is highlighted. The less time nurses spend during shift reports, the more time that they are able to directly care for the patient. It has been noted that adverse medical events that occur as a result of ineffective handoff reports may present themselves in a variety of ways. Canadian-based research states that these events can increase a patient's length of stay anywhere from 0.4 to 24 days. Because the patient's length of stay is increased beyond the intended duration, the hospital is set back financially, as they must now use additional resources to ensure the patient's well-being. These increased lengths of stay place significant financial strain on the hospital itself, suggesting that improving communication during the nursing handoff is a financial and operational necessity. Once the proposal has been fully implemented and established in the workplace, the flow between shift changes will be optimized. An immediate objective benefit which will occur as a result of this project is the reduction of preventable adverse medical events. Furthermore, the proposed standardized shift report will convey all pertinent patient details in as few words as possible. This effective and concise relaying of information allows nurses to spend more time with the patient as the time spent during shift changes is reduced. Overall, once the project is implemented, nurses will know exactly what information to include during the handoff. Evidence depicting how a standardized shift report may benefit the unit has been well documented throughout a variety of studies. One specific peer-reviewed study found that after enacting a standardized shift report, the number of adverse medical events decreased from 102 to 25 incidents post-intervention. Depicted as a visual representation of the project's 4 key phases: development, implementation, completion, and evaluation. Starting with the development phase and ending with evaluation, the project spans a total of 8 weeks. The initial development phase lasts 2 weeks and ensures that the project aligns with key stakeholders and allows for enough time so that the electronic medical record can be updated to include the standardized shift report. After the first 2 weeks, the implementation phase will begin. During this phase, staff members will be actively trained on using the new protocol. Finally, by week 6, the protocol will have progressed towards full completion, leaving the remaining time to evaluate the project's success. Dedicating the first 2 weeks to project development ensures that the electronic healthcare system is fully stabilized and calibrated to correctly display the standardized shift report. Having the implementation phase begin at week 2 and reaching completion by week 6 allows for the staggered training of staff members without too many nurses leaving the unit at a given time. Lastly, the final phase of the project allows us to gather objective data and establish trends which ultimately determine staff compliance and the project's success. This slide provides a visual representation of both the direct and indirect costs associated with integrating this protocol seamlessly into the unit's current infrastructure. Because this protocol will be using existing resources, the budget required to implement a standardized shift report is cost-effective. The indirect cost primarily consists of the paid 15 minutes each of the unit nurses will need to complete educational training regarding the protocol. The primary direct cost will be the amount of money required to pay the informatics specialist to update the electronic medical record. Overall, this project will cost around $3,500 once fully implemented. Approximately $2,000 will be allocated to cover the staggered training of all 4 nurses, while around $1,500 will be used towards paying the specialist an hourly rate. The implementation of this project relies on pre-existing and established resources. These resources include the time of the involved parties as well as the existing electronic medical record. Because the new standardized shift report will be directly integrated into the established medical record, the finances required to fund this operation are minimal. By using existing hardware and resources, the project remains budget-friendly with the potential to prevent costly adverse medical events. As stated previously, the project will cost around $3,500 to fully implement. The new standardized shift report will be a checklist in which completion is required before the system allows the user to document other tasks. Because this checklist will be directly embedded into the EMR, a simple audit of the system can determine if nurses are complying. As noted in recent research, electronic medical record systems can support patient safety and clinical handover with contemporaneous documentation. By collecting data directly from the electronic medical record, reporting bias is eliminated, and staff are held accountable. Similarly, the EMR will be used to gather data regarding the occurrences of adverse medical events. Together, this information will be used to determine the project's trajectory. Specific metrics will be used to determine if the project's goals have been met. The first measurement indicative of success will be to reach an 85% compliance rate for daily use of the new protocol within the electronic medical record. This applies to all 4 nurses on a given unit. Simultaneously, we will closely monitor reported adverse medical events. This will determine if the protocol has led to a 15% reduction in such errors post-implementation. These 2 primary goals will be used to determine the project's success and will be tracked over a period of 2 months. After the project has completed its 4 phases, the data will be collected and analyzed with the help of the Quality and Patient Safety Committee. Here, they will use the data to determine if the protocol should be permanently implemented. These findings will also be communicated directly to the frontline staff during frequent meetings. This is done to reinforce the validity of the protocol and celebrate specific milestones. If the data suggests that the protocol has led to a significant reduction in adverse medical events, the findings will be used to support implementing the proposal across multiple hospitals. If the data suggests that errors were not significantly reduced, there lies an opportunity to modify the proposal. Existing literature confirms that these methods have been proven reliable when it comes to making evidence-based change. Specifically, one article notes the importance of nurse informatics team during the evaluation process. They state that this team must continuously evaluate the newly proposed intervention to ensure that the protocol does not negatively affect the nurse's workflow or cause any unintended consequences. In summation, the implementation of a standardized shift report such as the S-bar provides nurses with an evidence-based solution proven to decrease the amount of adverse medical events. Throughout this proposal, it has been demonstrated that implementing such a protocol is cost-effective and can be seamlessly integrated within existing infrastructure. Once the funding and approval of key stakeholders is secured, the automated checklist embedded into the electronic medical record will reduce critical gaps in information. By aligning the shift report with a mandatory checklist, we are able to ensure that nurses are transferring all pertinent details about the patient. As a result, patient safety is protected and the hospital benefits from reduced financial burden and hurdles associated with adverse medical events. Proactively implementing this new protocol gives structure during the vulnerable nursing handoff while also providing an objective solution to combat medical errors.